So do you have pain when you reach? Pain that might be in the arm or in the elbow, or pain on the same side as your breast surgery? It might not be there all the time, or it might be soon after your surgery, the pain and the tightness is difficult for you to reach up. This may be cording. Cording has now been recognised as a common experience for women after their breast cancer surgery. And it may be the reason to explain why many women, years after their surgery, have persistent shoulder problems. So cording is worthwhile checking out. It is a tightness of the tissue, and I'm going to tell you about my ebook. I am so excited to introduce you to my ebook, Cording, a Self-Assessment Guide. The Cording Guide has been on the table for quite some years. It's been a challenge because what we have is not what I think is good enough. And so I've been working on some new ways of assessing cording. I presented this last year at a conference. This year it's all about for you, the woman. So you can take this information in your own home and be able to work out what is actually going on. Now, this is brought about because of the difficulty in being able to know what's going on after breast surgery. For example, a case that came in the other day, and she is 2 years after her breast surgery. And she says to me, you know, Denise, I don't want to be whinging. And, you know, but people suffer more than me. But I've got something that's just not quite right in my breast and in my arm. So I feel this pain in my arm every now and again, but every now and again each week. And it's 2 years after her surgery. And this is a common complaint or a common experience, is that the pain, when it's not acute, and so it's not in the first couple of weeks of following the surgery. So what I have done is work out what you can do to work out what's going on. So what we've got is a couple of assessments, and you progress from one assessment to the next, and there's different steps in each of the assessments. So when you come to the end of your self-assessment, then you've got a bit more of an idea about what is happening in your arm. And you might ask why this is the case. And it's because the sensation in the breast isn't like it was before the surgery. And so you haven't got that sense of what's going on. And it's a bit hard to see down there. These are some of the reasons why it is hard to be able to know exactly what's going on without a little bit of help. So once you've gone through the assessment guide and you think, I think that this could be cording, then you go through the information about what do you do next. And so what you want to be able to do is be able to get help. And so your first port of call would be back to your clinic, and you can present the information about your test. Now, don't be surprised if they don't use the same test, because this is brand new. So this test has been developed by me based on my many years of experience with women that have got a whole range of versions of cording. And so you might be the first person that takes your therapist or your doctor through the testing procedures. But don't let that stop you. It isn't a complaint. You're not whinging. Whinging is an Australian term, but you're not complaining. Treatment does exist out there. So there are some treatment options. I've got some information out there on the YouTube about those treatment options. I'll put a reference up at the end of this, but this is about the cording, the self-assessment guide. It's simple. You can do it at home. You won't be able to diagnose cording, but you can take your suspicion of cording if you run through the test and find this tight tissue. So what is there left to talk about? If you think that you've got tightness, let's find out whether it's cording. Go buy the e-guide, and please, up front, I'm going to apologise. When you pay, I'll get advice and then I'll email the PDF to you. You'll go through the tests. You'll work out what's happening in your arm, what's happening in your breast, what's happening in your elbow, and then you'll be able to present that information to your breast clinic. I'm just going to remind you again why. It's because you can work out what treatments are available for you so that you can get the help that you need to be able to recover more fully from your breast cancer surgery.